Hello and welcome to the Farm Family Wellness Alliance webinar. I'm Sherry Rogie Fiddler, President and CEO of Farm Foundation, and thank you so much for joining us today for this really important topic. We're looking forward to sharing some information and kind of who, what, when, where, why, and how of the Farm Family Wellness Alliance. Next slide, please. So in terms of what we're going to tackle today in the webinar, first I'll kick off with an overview of the Farm Family Wellness Alliance, and then we'll have the two primary service providers of Togetherall and personal assistance services share more about those particular services. And then we'll wrap up with hearing from two of our alliance partners. Just a reminder that throughout the webinar, we encourage you to post your questions in the Q&A section, and we'll try to actually address them in each of the sections in case the service providers need to show something different within the portals there. So I encourage you to do that. And we are recording the entire webinar, and we'll be able to share that afterwards across our whole network. So let's dive in. Next slide, please. So for those of you who don't know Farm Foundation, we are a 90-year-old plus 91-year-old organization established as the first Ag Policy Institute in the US, and we now are positioned as an accelerator of practical solutions for agriculture, accelerating both people and ideas into action. Next slide. And our mission is to build trust and understanding at the intersection of agriculture and society with the vision to build a future for farmers, our communities, and our world. Next slide. And this is the context for our Farm Family Wellness Alliance in terms of it fitting in our portfolio of work in our think tank, do tank model. You'll see the four areas of our project work in the wings here on digital ag, conservation and sustainability, market development and access, and then farm family health. And we meet that in the most holistic way from financial health and mental and physical health. So that's part of our why in terms of Farm Foundation's involvement in the Farm Family Wellness Alliance. Next slide. So I'm imagining that most of us here on this webinar today understand the why for why mental health and well-being matters to farm families, but I think it's still a good idea just to anchor ourselves here. I won't read everything here, but I will just share personally. I am a fifth generation farm owner operator myself, and I know firsthand how many stressors there are to farm families and ranchers across the US, whether it's the pressures and vulnerability of severe weather events. We can, in our operation, we can have wind, hail, drought, and flood all in one season. That alone is enough of a stressor. Plus, you add to that possible generational issues, the uncertainty around transferring to the next generation, or the pressures if you're a first generation farmer or rancher. So we all know and appreciate the stressors that farm families across the US endure, and we all are aligned in trying to provide wonderful resources for them. So that's why we're excited for this webinar today and for the Alliance providing the services. Next slide. So in terms of the Farm Family Wellness Alliance itself, this was established a few years ago. We did a pilot in 2020 with a vision of starting in a very focused area where there had been some severe weather in Iowa. So we really started in just a few counties in Iowa, but we did from the very beginning have the vision to have this be a national service. But we started in a very focused way in a few counties in Iowa, then spread it to all of Iowa, then to Illinois. And then we were just so thrilled this year to have the resources and the partners to launch it nationally. We launched it in January at the American Farm Bureau Convention, and we're just thrilled to have so many wonderful partners to be able to elevate this to every farm family and ranchers across the US. Next slide. So these are the wonderful partners that enabled this to happen this year. So we have both funding partners and marketing partners that you see on this slide. And we're always seeking new partners to continue to get the word out to every farmer and rancher in the US to have access to these services. So if you're not part of the Alliance and you're interested in becoming part of the Alliance, please do reach out and let us know. And you'll be hearing from some of these partners today during the webinar. Next slide. So this is, as you probably know, Mental Health Awareness Month. And as part of this, we're raising both awareness as well as support for the Farm Family Wellness Alliance through this t-shirt. And we'll be posting that link in the chat section in case you're interested in supporting the Alliance through a donation and a thank you gift for this wonderful t-shirt. Next slide. So this is the focus of our webinar today, is we'll be sharing with you the suite of services in this unique alliance. So it begins with an online peer-to-peer community from Togetherall, and that's the sort of starting place that everyone can access. And then there's a suite of wraparound services that we'll hear about from Personal Assistance Services, PASS. And then the rest of the Alliance really helps us get the word out, which is really critical, so that all the farmers and ranchers know about these wonderful suite of services provided at no cost to farmers and ranchers across the US. So with that, I'll pass the baton over to Togetherall to get us started and to share the wonderful platform and peer-to-peer support that you have. Mary Lynn, over to you.
Thank you, Sherry, and thank you all for joining us today. Really excited to be here. I've been with Togetherall for over a year now and have worked in the mental health space for I guess 5+ years, and really got involved in the space for my own personal mental health journey. I know that there's limited resources out there, and so we're really excited to bring forward more resources. So I'm going to share what the actual platform looks like, but basically this peer-to-peer community is available to all farmers across the US, as well as their family members, and really anyone that works in the agricultural industry. We know, as Sherry mentioned, there's a lot of unique stressors that folks are facing. And so to be able to have a platform where you're able to speak amongst your peers and speak to other people that really get it is hopefully a comforting thing. One of the unique features about the Togetherall community, which I will share in a second, is it is anonymous. So I know for many people on their journey, they're not quite ready to share that, they might be struggling. And so the fact that you're able to participate in the community and remain anonymous is something that is very unique to this platform. And we've been at this for 15+ years. Togetherall was actually founded in the UK. And so, it's been a work in progress. And I think it's in a place now where we have a very vibrant community. We have tens of thousands of folks on the platform monthly. And we have our oversight of clinicians 24/7. So it's a very safe space as well. So I will just share my screen here and first show you how you could go about registering. And after I finish speaking here, I'll actually drop the direct registration link into the chat. So essentially, though, if you go to togetherall.com, I'm assuming you all can see my screen at this point. If you can't, just let me know. But you'll go to togetherall.com. There is the option to click on, I'd like to search for my organization. And then you would just type in Farm Family Wellness Alliance. And then you're able to just register from here. There are a few questions that you will have to input. There's also, you have to verify your email. So you do have to leave the platform for a minute, verify your email, and then it will bring you back to the community. So it's pretty straightforward. Here they've given me a randomly generated anonymous username. If you don't like this username, then you have an option to select one of the other options below. So once you've registered, you will then be able to come back into the community, and this is what it looks like. So given that you all would be registering through the Farm Family Wellness Alliance, you will get a pop-up when you first register that says head to the agricultural group. And so I will mention that the community is for the Togetherall platform is available and open to a number of different industries. However, we want to make sure that folks in the agricultural community have a space to go and really speak to other folks that understand what they might be going through. So here I'll just click on visit the agricultural group, and it will take me directly into the subgroup, what we call it, for where you can find all discussions related to farming. And you can really filter it based on what you might be going through. Again, some of these items and themes might be specifically linked to mental health issue, but rest assured that, regardless of what you're going through, that's specific to farming, you can type that in and hopefully find someone that also can relate. But you can really configure your search so that you can only see, things that you really want to be either reading about or participating in. Some people come to the platform and just kind of scroll through and they'll read what other folks are talking about. So someone here in January stated farming is hard. I've just been thinking a lot today about how important farming is, but how hard it is to stay in the business. And, just talked about the discouraging, that it's an uphill battle. This is a wall guide. So this is what our nickname for our clinicians. So the wall guide came in just to kind of make sure that they were responded to, because there's nothing more daunting than sharing what you're going through, being vulnerable, and then not having anyone kind of come forward and respond to you. So that's why the wall guides are there as well, to be able to make sure that you feel included. But really they want to encourage other folks in the community to come in and share their support. So there was a number of folks that had a back and forth. There is the option also for people to go into a little private chat. So if you find that you're speaking to a few people and you're really kind of connecting and sharing each other's experiences and really finding that support, there is the ability to create a small group for that. This here, if you go back to your home page, this is the broader community. So again, this is going to be open to many different industries. Some folks that might be dealing with, anxiety as it relates to all things might find that this is a good option to come here as well and find some peers that they can chat to about that. And again, you can customize your feed. So you can, either say you want to read topics that talk about anxiety, depression, recovery, and maybe you want to avoid things that talk about PTSD, or, maybe there's some other areas that might be triggering for you. So you can configure it that way. And then to get back into the groups, you would just go to the community under groups, and then here you would see the agricultural industry. So you can go back into there. We have a number of other resources such as courses. Some people are dealing with improving your sleep, managing anger. And so there's a number of other courses that folks can take to really kind of do that psychoeducation and learn some tools to be able to deal with whatever you might be going through. Yeah, so there's a number, and then there's also just some articles and content on various topics. You'll see here, I forgot to mention this chat here, Ask a Wall Guide. So that's, again, our live clinicians. They're there 24/7. And so what's unique about this in comparison to some of the other forums out there is that it's monitored and moderated 24/7 by live clinicians. And so at any point, if you would like to get in direct contact with a clinician, you can do so here, Ask a Wall Guide. And if they feel that a member is at risk, based on a post that they shared, they can also intervene and directly contact that individual. So I would say the two unique things about this in comparison to like a Reddit forum or one of the other forums is really the fact that and then also that it's really safe, because we have this 24/7 oversight of live clinicians, and they're all licensed clinicians. What else can I show you? So again, there's many ways, like people come on and they maybe just they feel comfortable only to read posts. So they want to hear what other fellow farmers are talking about. And so you can simply come on and just read and not participate. And then maybe in 2 months from now, you're really going through something, you want to get some advice, you're not ready to do any sort of one-on-one counseling, you want to hear from other peers in terms of how they're handling situations. And so at that point you can share. So it really depends where you are on your journey and how comfortable you are. Under this resource section, I'm going to pass it over to my colleague, Amy. You're able to, in addition to self-assessments, you are able to see some of the other resources that we have available through the Farm Family Wellness Alliance. So I'm going to stop sharing my screen here. I will put in the chat the direct registration link, so it's easy for you to go in and register. And if you have any questions on the platform, feel free to ask in the chat and I can answer those.
And Marilyn, yes, we did actually have one question come in, and then I had one or two things to amplify as well before we pass the baton to Amy. But the question that came in is about how to access this in rural America, and if there's problems with broadband in rural America that gets in the way of people accessing this. And I think it might be a good thing to elevate both the phone versus a computer way to access it.
Yeah, so we aren't an app. However, we do have, you can access through your phone and you can navigate it quite easily. It looks basically the same, but through your mobile, and then also through your desktop. And so if there are any situations where there are challenges, which I don't expect that there would be, but if they are, then you have the option to try through your mobile device as well as the desktop as well. So yeah, we haven't had any issues come up where people have had a hard time to access in rural communities, but of course, I know that in some cases that may take place.
And I would thank you, Marilyn, and I would encourage the second part of the question was, are there any aspects of the Alliance that are helping to kind of bridge the digital divide to get more people to have access to this? So if anybody in this webinar is aware of other people who should join the Alliance to help with that, I certainly encourage you to put that in the chat as well for us to follow up with. And interestingly enough, our Farm Foundation summer event is about bridging the rural-urban divide. And I think this is an ongoing issue for us to continue to reach as many people and as many pathways into rural America to help elevate awareness of this. So thank you for that question. And you can continue to put questions in as we go through. And again, before we pass the baton, Marilyn, a couple things I think are noteworthy are, I believe you've tracked, over a few years, at least in Canada, how many issues are resolved in this platform, so that even though we do have the wraparound services that we'll be going to next, for many of the users, you've said that the issues are resolved in this kind of peer-to-peer community. Can you speak to that just a little bit?
Yeah, for sure. I think, this platform is really an as needed kind of platform. And so when folks are going through a particular stressor, they might come here to kind of express what they're going through. And yeah, oftentimes they may go on for a period of, just a few times, and they're really given that validation and given what they need. And so they may not come back on, for another month or two. And so we recently actually put out, we did a research study, and we'll be putting out a white paper in September that really speaks to like the therapeutic value of peer-to-peer support. And what's great about that is that, there's agricultural industry is massive, right? And we don't have enough clinicians to be doing these one-on-one counseling services. And so to be able to have this kind of what we call a population health approach, where we're really able to reach, we can, there's no limit on how many people can come to the platform. It's really a wonderful thing that we're seeing. And like I said, there'll be a white paper out on that really talks more about the therapeutic value of this peer support approach that we have.
Great. And a second question just came in, triggered by that discussion right there, that says, is there a way to physically talk to a peer, or is it only a licensed clinician? And I think you mentioned that you can message each other, but could you clarify that a little bit?
Yeah, so physically, because it is anonymous, that will always remain the case. However, you can have that direct, more private interaction with a peer in a group, in a chat. However, that chat as well will be monitored by clinicians. So they'll be overseeing that again, just for safety purposes. And then also you have that one-on-one with the live clinician. But physically, when I hear that, I hear, going in person to sort of a peer support group. And I don't know, Sherry, if there are some of those more in-person peer support groups that are available out there, but I know that there are a number in many different industries, and so I wouldn't be surprised, but that is kind of different than what we're doing here, although the value of it is, quite similar.
Great. Thank you. And then last, I think certainly compared with when we started the pilot directly with personal assistance services. And so the option was to go directly for services. And what we've seen now that we've launched this new tool, this peer-to-peer community, is that we've seen a dramatic increase in a diversity of men and women using these services, which is really encouraging to see the diversity of both age and gender as we've launched this nationally to have different options for different needs. So appreciate that. And then
Yeah,
as
for sure. And just to add to that, we do find that this, because again of the fact that it's anonymous, some of the demographics of folks that typically have a harder time reaching out for help due to higher levels of stigma. And we know men, unfortunately still suffer with a lot of stigma. We do find that this is a platform where folks that are typically underserved are utilizing this. So we're kind of catching a group of people that may not be reaching out for help otherwise.
And I think the early statistics this year have also shown that it's a large majority who have no other access to any other resources is what they report as they come into this. So again, very, very necessary and helpful. I think I just saw one more question come in before we go on. It says, are there spaces specifically for youth to connect? So I think that's a good one too.
Yeah, so we are only available to 16 plus. However, there are absolutely spaces, a similar a group where students can participate and can speak amongst themselves. In terms of a group specific youth group for the agricultural industry, we don't have that yet. However, potentially that could be something we can consider later down the road. But for the demographics in terms of age on this platform go from 16 to 80 plus, 90 plus. So
you could choose a youth option or the ag option at the moment, but not
exactly.
the ag
But
option.
the youth option would be youth overall in post-secondary schools in different industries. It wouldn't be only specific to ag.
And one of the things I believe you said from your experience too is if someone comes onto the platform and is having, for example, some addiction problems, much of that is not much of that is more universal. And so many times they feel very comfortable addressing that in the addiction group on this
Exactly.
portal rather than needing an ag specific addiction group. But then they have
Yeah.
both access to the ag group and the addiction group, just as the
Exactly.
youth and ag.
Yeah. Depending on how you want to connect. Sometimes you might want to speak to others in the industry. Sometimes you're just dealing with you know, a mental health challenge that's not specific to ag. So you have the option there as well.
Great. And I think we had one more question coming here. Do you have literature we can carry in our pickups and hand out to farmers we think may need your services? And that's a great question. I was going to say at the end of the seminar that we have a suite of assets and resources. We don't necessarily have them for all pickups in America, but one of the things we had, and I wish I had one to show you, is we have an air freshener that was a Farm Family Wellness Alliance air freshener to hang in a pickup, and it has a QR code. And I will say I had those with me when I was in a hospital in a medical situation, and I handed out 10 of them. And I know some of them have been used because they reached out afterwards. So we're continuing to find what are the best ways to reach everyone. And so appreciate your input and advice on that as we move forward too. So I think at this time we'll probably move on to Amy, and then we'll come back to any other questions that come in as Amy from Personal Assistance Services shares the suite of resources that wrap around from the platform. So over to you, Amy.
Thanks, Sherry. So my name is Amy Mers. I'm located in the Midwest here in the US. I am an ag credentialed clinician. I've worked in mental health and in a farming community for 30 years. I live and work in a farming community, and I work at Personal Assistance Services. And so we actually were part of that pilot program and are super excited about this current option, because what we know is that there's definitely the benefit of folks who speak ag, who can talk to each other about the unique challenges. So I had actually somebody say to me in this process, it feels like there's so much isolation and loneliness in the rural and ag community. Does this encourage more of that? And actually, we already know that there is that isolation. And so if that's already going to happen, but there's also challenges with schedules and time. One of the things that we really like about the Togetherall platform is that it's 24 hours and that you have that peer to peer. So when somebody asked about having direct conversations with folks in the platform, that's really the goal. That's the main reason why we wanted to have this option, so that folks can talk to other folks who get it, not just clinicians. There are definitely clinicians available, and that's what we do here, and I'm going to share that. And also, just to reiterate, that you can also be in more than one group. So if you want to talk about grief, or you want to talk about single parenting or whatever, you can talk to other folks within this platform. I also want to show you that, so Personal Assistance Services is an organization. We provide mental health and well-being services nationwide in the US. And so I'm going to share a little bit about that. And so we are the next step. If you find these connections within the Togetherall network, but then you're like, okay, what else? I'm motivated. I want to work on these things with my family. These services are available for any ag related person and family in the United States. So if a person has a farm, or they work with farms, or they work on a farm, or they serve farms somehow, you have access to this Togetherall platform and also the past benefits. And so that's really important, because it's also your family members. So it's a very liberal benefit. So those statistics that Sherry mentioned earlier, those are things that when I present to general audiences, and I talk about statistics, and I talk about concerns, and also suicide rate and risk of suicide, I have a whole list of folks that are more at risk. And I always ask the audience, is there anybody on this list that surprises you? And every single time I do this, and I do this a couple times a month, every single time somebody says the farming community. That surprises me, that is high risk. And so this is also something that is not talked about nearly enough. And so that's the other reason why we're really excited to provide these resources. So when you're in that Togetherall platform, so you're in here, you can see, so here's resources when you click on that. And Mary Lynn had showed some of those courses. Now within those resources of the Togetherall platform, you also have some other tools in here. So journal and goal setting, and also some self-assessments. So those are some great ways to kind of ask yourself, where am I at on this spectrum? Is it something concerning? Do I need to take the next step to get some help? And so there are definitely opportunities for you to learn more about yourself, to get some intervention. And so that's one nice thing about having this as a mental health platform with those wall guides, because sometimes somebody is reluctant to get help and they just need a little bit of a nudge or a little bit of support. And so that's where having peers in there saying, hey, go for it, just don't hesitate to ask for help, or those wall guides doing that next step of reaching out to say, hey, are you doing okay? At PASS, we're a mental health provider, but we're also a well-being provider. So you can find out more about us through this resource page. And there are some digital tools that you have access to, like a well-being app, like a mindfulness app. And I'll show you some of that, and then some resources and articles. But the one I want to bring most to your attention is our website. So if you click view for the Farm Family Wellness website, so you can see that that's a direct link within that Togetherall page. that's going to take you to our farmfamilywellness.com page. So this is specific. So everything specific to this program and this audience. So like I said, any ag family in the United States has access to everything that I'm about to show you. So that is also the question that I get when people contact us through this contact us link. One of the things that they say and you'll actually talk to me, so you can contact us and then I will contact you back. They'll say, are you kidding me? Are you saying that all of this is available to folks in the entire United States? And the answer is yes. And so that's where when Sherry talked to you about those alliance members at the beginning, those partners are funding this. This is, you have these marketing folks that are helping get the word out, and you have these funders that are saying, this is an important topic that we want people to get these services. We know that we need it. How can we reach them? And so everything is available. So this is one way to contact us, to do it directly through this website. You can also call us. We have a farm specific phone number 24 hours a day. So, and let me say that again, it is 24 hours a day answered by ag competent clinicians. And so we know that your schedules are not normal most of the year, that, you're not working 9-to-5 jobs. And so when you need to talk to somebody, if it's because you're not sleeping in the middle of the night, or it's Sunday evening when you finally get a chance to make a call, you're going to reach an ag competent clinician, a counselor, a master's level counselor who's licensed, who also knows about these topics and can give you that support, or can talk to you about the next step in accessing these resources. You also have the opportunity to text with us. So if sometimes you're not at a place where you can make a phone call, you don't have time, or it's not confidential, or you just prefer to text, you can also text with those same master's level clinicians. Now that is 9-to-5 Central Time in the United States. So that is not 24 hours a day, but that is an alternate way to connect with us. If you decide that you want to use our contact us button on our website, then you can let us know what's the best way to contact you back. So, what's the best time of day? Do you want an email? Do you want a call? What's the best for that? So that's the other thing that I want you to show you. And then everything is HIPAA compliant. So everything that we do at PASS is confidential. It's all HIPAA compliant. So just like the doctor's office. Now, one of the things that I will share with you that sometimes can be frustrating is, because of HIPAA, if somebody is 18 or older, somebody else cannot access their records. They can't make an appointment for them. And so we know that you're busy, and so we know that that can be challenging. So if a family member or a spouse wants to make an appointment for someone else, it's not always okay to do that just because of confidentiality reasons. So it helps if you can get them on the phone, even if just to give permission. Hey, yes, this person can make an appointment for me and I got to go, but can you just talk to them? And then we can take it from there. So I just want to let you know that. So here on our homepage, you can scroll down and you can see a bit of an overview and some links. So here's that link. If you happen to find us first and you want to get to Togetherall, then you can get there from us. So we can get you right there. And then here's our digital tools that we talked about. But what I really want to focus on is our services. Now you can find them in this top menu here, or you can just click here to learn more about the services. Everything on here is a service that is free and confidential and available to you and your family members. So free family and individual counseling, nutrition and health coaching, financial consultation, retirement coaching. I'll click on a few of these for you. Legal consultation, free legal consultation. So this is an initial conversation with an attorney. So it's not a free attorney that you go and hire. It is an initial conversation where you can have a phone conversation to just check in with somebody. So, hey, here's what I have going on. I'm not sure if I need an attorney or not. Here's the situation. And so if you do decide to hire an attorney, it's a 25% discount on that legal plan, on that legal fee. And so that is something where you also will be asked, what kind of attorney do you need? What state are you in? So we get you somebody who is in your own state. And what kind of attorney? So is this talking about generational farming, and we want to make sure, maybe it's business law, or maybe it's family law, or maybe there's a dispute, or maybe there is an issue with an estate. And so just depending on what kind of law, that's going to be the attorney that you're going to be connected with. We have organization and productivity coaches. So there are a lot of responsibilities and sometimes it can be very overwhelming. So getting folks to help you get organized or time manage, or kind of, sometimes folks have more than one job. So you're doing your farm, but you're also doing another job. And so how do you navigate those things? So we have organizational coaches that can help you. We have parenting and childcare consultations. So parenting consultants who can talk about child development and discipline and learning issues and school issues. Elder care management, I always say, is one of my favorites because it's anything that older adults. So like if you need help finding rehab for an older family member, or you have questions about Medicare, or how much things cost, or how to make decisions, or how do I know if this is dementia or not? These are folks that specialize in that. We have career consultations. So let's say that somebody is trying to decide if they want to stay in the ag industry or if they want to get out of it. Maybe somebody's graduating from high school and they want to get a degree or go to vocational school, but they're not sure how to pay for it or where to go. These are folks that are these education planners and career consultants can specialize in those topics and even help somebody with those steps. It could be resume building, it could be looking for a job. We have nicotine cessation coaches that are skilled in nicotine cessation. We have life coaches to help with some goal setting and goal accomplishment. So maybe you want to start a side business, or maybe you want to write a book. You have somebody that's going to help you with those things. I also want to scroll up here to the things that I kind of went through quickly. Free financial consultation. This is probably the most commonly used service that we have, which is having somebody talk to you about your financial situation. So I know that people in the ag industry have many resources for that. And so this is not in competition with anything else. But if you do want to talk to a financial consultant, it can be something that's either a goal or a challenge. And so that could be, it's been a rough year and we're not sure, how we're going to pay our bills or what resources are available. Or maybe you have a financial goal, like you want to have a certain amount of money saved, or is this a good time to sell? Or is this what happens to those student loans? Are they really going to go away or not? And so the financial consultants everything that we do here is individualized to a person's goal. So these are over the phone, other than the counseling. I'm going to talk about the counseling in a second, but all of these services are over the phone and individualized. So you make a time that works for you and your family to meet with them, and then they talk to you on the phone about what you need. And then they either consult with you, coach you, or they provide resources for you, but it's all individualized to what your questions are and what you need. And then there's also follow-up with all of these coaches and consultants who will follow up with you in a week or 2 weeks. And how is that going? Is it working? Do you need anything else? Our retirement coaches, I know this is kind of a tricky situation because sometimes we just work and work and work and never retire, but you really want to enjoy your retirement. And so that can be kind of tricky when you are in this field, or when you have a farm that you own. And so are you going to go part-time? Are you going to completely retire? What's that going to look like? You certainly want to enjoy that time, that retirement, because you've worked so hard for so long. What do you want that to look like? And so our retirement coaches are anything that's not financial in retirement. And so it could be, how are my spouse and I going to work together 24 hours a day when we hardly ever see each other for the last 40 years. So just a lot of different topics with that retirement. I want to share, well, first of all, I want to say that all of these have links to learn more about them. So let's talk about nutrition and health coaching, because this is actually, with our farm folks, this is actually one of the ones that comes up a lot, that people use a lot. And so you have access to a free dietitian, health coach, fitness coach, and we actually now have a sleep coach. And so these are individualized coaches. It could be something very broad, like I need to get healthy, or it could be something specific, like somebody has been diagnosed with pre-diabetes and they need to change their diet, and maybe you don't have a lot of time to eat healthy. And so our health and wellness coaches talk to you individually about your particular lifestyle and your goals, and what do you want to do, not what should you do or what your doctor say that you need to do, but what are your goals, and specifically work with you on those goals. So all of this, again, is over the phone, is confidential, and it's free for you and your family members. So, and I don't just mean only prediabetes, it could be anything. We have folks call in about cancer prevention nutrition. People talk about going with a plant-based diet, but they want to make sure they get their protein. I mean, just a lot of ways to do that. The sleep coach is anything that has to do with the behavior of sleep. So it's anything that has to do with, you know, why aren't you getting enough sleep? What's on your mind? You have a lot on your mind. What are some of the changes that you can make to help you sleep, even though you have this schedule at different times of the year? And so they work with you individually, not just in general. The last thing I want to talk about here is the counseling benefit. And so the counseling benefit can be individual or family counseling. And so again, as I said, these are ag competent clinicians. So we have our own database of affiliates nationwide. So we serve folks in the entire country, and we keep our own network of clinicians that are within our network that are covered under the past benefit. And so that means you also. And so what that means is when you contact us through that farm phone number, or you email us, or you contact us through the website or text with us, and you say, my family needs some counseling, we know that there are some topics that folks want to talk about. So we make sure that our clinicians can also speak farm, speak ag, and that they can be available the way that you need them. So we also know that rural communities, sometimes, I know this is, we're used to driving long distances to go into town to get what we need. And so we at PASS are constantly enhancing our network. So if you do know of a clinician in your community that you think would be good in this field, we are also continuing to build that network. So if you know that you want to see someone, you can ask, hey, can this person be added to the network because I trust them, they've helped my family, and so we can do that also. You also can utilize these services in person or virtual or over the phone. So, we talked about earlier, the question was about broadband, and I certainly can, the amount of money I've paid for internet where I live, it's outrageous. And so I know that's not always easy. So if you can have counseling over the phone, if that's preferred. You can have counseling virtual, which is like over a Zoom platform or over the computer. You can do it through FaceTime. There's a lot of different ways to do that. Or you can do it in person. And so one of the things I will tell you is that we have found that this virtual network has really helped. That's one positive thing post-pandemic, is accessing services because through the virtual platforms, because now if you live in a rural community, like I live in southern Missouri, and there are maybe a handful of providers that are close to me, but now with virtual, I can see anybody in the entire state of Missouri. So when you see a counselor can only see somebody in the state where they're licensed. So I'm a counselor, I'm licensed in Missouri, I can see people in Missouri, but virtually I can see somebody any corner of Missouri. So that's another option. You don't have to choose virtual, but it does give you many more options. It also gives you more times to choose from, because the other thing that we know is that people also need counselors that can see them in the day, in the evening, on the weekends. And so we have clinicians that have hours available. The other thing that we do, so let me talk about what happens when you contact us. When you contact PASS, what happens is you get a counselor on the phone, and we're very much about customer service. So we're not going to say, here's 3 phone numbers, good luck. We're going to talk to you, first of all, and give you in the moment support. How are you doing? Do you need anything? And so we always do a risk assessment. We always talk about, what do you need? How are you doing? Do you have any concerns? And so if you have any crisis needs, we can handle those too. So if somebody's in crisis and you call us at 3 o'clock in the morning, we can help get you where you need to go. But otherwise, what we do is we help you find the counselor that you want. We will contact them, make sure they have openings before we connect you with them, because we want to make sure that it's a good fit and make sure that they have openings. And then we allow you to connect that with them to set that appointment. And then we will also follow up to make sure it was a good fit. So you can be using it for individual counseling. You can be using it for family counseling. Somebody else in your family, like your child, maybe your teenager, can use it. So there's different ways to access it. So, so that's what we have. So
Thank you, Amy. We did have a question come in regarding ag competent counselors, what you mean by that, and what kind of training they get to become ag competent.
yeah, so there are some specific training courses out there. So there's a couple different routes. There sometimes, well, let me backtrack. Any clinician that we have in our network, we have an application where we ask them about their specialties and what's your background. So not every counselor can counsel every topic. And so sometimes people are ag competent because they are a farmer themselves, or they've lived in the farming community, or they've worked with farming families their whole career. But more importantly, it's if they have gone through there are some national credentialing, it's not a credential, but some trainings that really talk about some of the unique stressors, some of the unique statistics, some of the language that's used. So it's not just a cookie cutter type of counseling. And so we have actually done our own internal training where we have provided training to our clinicians. We also have a clinical specialist that we consult with who is a third generation ag family, but she's a clinician. And then we also have done some online training that has been ag specific. So those are the questions that we ask in the application process, and then we confirm that also.
Great. Thank you so much, Amy.
Yeah.
And thank you for all that you do. And I think that was helpful to walk through the wonderful resources that you provide. And so we'll still continue to take questions in the Q&A section, but at this time, I'd like to invite both Jessica and Terry to come on camera. We have two of our Alliance partners who are going to share a little bit about why they joined the Alliance and any aspect of it that they would like to elevate. And Jessica, I see you first, so we'll begin with you.
Okay, thanks a lot, Sherry. My name is Jessica Cabrera, and I'm the Managing Director of Member Engagement at American Farm Bureau. And I serve as the staff lead for our Farm State of Mind campaign, which is American Farm Bureau's national mental health wellness campaign for farmers and ranchers. American Farm Bureau came along early in the process with, not in the pilot alliance, but in the 2.0 version of the alliance, and particularly with being able to get these resources of Togetherall and past services out to farm and ranch country all across America. And part of it, I think for us, it was member driven. We had heard often from our members that how important peer community is, and also how important it is to have opportunities where the stigma is not so prevalent. And we have a sounding board where we heard from our members and our state farm bureaus that this was something that they felt would be very relevant to not only the state farm bureaus and their efforts, but also to the membership. But in addition to that, we always like to understand what the research is behind things. And so, we went to the National Alliance of Mental Health Illness, which has published that community is critical for us to thrive, especially for someone who's already experiencing the common symptoms of loneliness and isolation, which is very common among farmers and ranchers and their family members. Also, there was research published by the National Library of Medicine that shows that individuals' sense of community is associated with reduced symptoms of depression, anxiety, and stress. So last Mental Health Month, we did a campaign for small gestures create big impact. And we were encouraging grassroots America to reach out to your neighbors and your friends and your family members with small gestures that can create big impact. And then we joined the Alliance soon after that. And this really just goes along with this idea that building a sense of community is something that will contribute towards reduction of those symptoms of depression and anxiety and stress. Our AFBF research that we conducted in 2020 says that 68% of farmers surveyed said that isolation had an impact on their mental health. So we think that anything we can do to reduce that isolation is important. And we referred to another study that was published by the National Library of Medicine that suggests peer support is associated with improvements in mental health, including greater happiness, greater self-esteem, effective coping, reductions in depression, loneliness, anxiety. So peer support not only has a positive effect on those that are being helped, but also on those who are providing the support. So as American Farm Bureau really wants to be in the business of connecting farmers and ranchers with information and resources that are going to promote their mental health wellness, we found that this resource was something that would align very closely with our objectives, but also with what we believe, research is telling us to be true. And it gives you that anonymous platform that reduces the stigma associated with expressing yourself whenever, like it's already been mentioned here today, sometimes, if you just get something off your chest when it's happening, then it might not brew and kind of fester and turn into some of the greater levels of anxiety and stress that can occur whenever something is bottled up and pressed down for a really long time. So we really like the ability to quickly access this resource and be able to engage really immediately whenever you're going through a difficult time. And our members are very encouraging members, and they like to help others. And so that's another thing we love, is that this gives a chance for those of us who maybe wouldn't know when somebody's going through a hard time, that we can engage on the Togetherall platform. We can encourage one another and give an encouraging word. So just really excited to be a part of this. And our President Zippy Duvall, is very, very supportive of anything our organization can do to promote the wellness and well-being of farmers and ranchers, because we like to say that a healthy farm is nothing without a healthy you. So what's the point of a farm if you don't have a farmer? So we need to make sure that farmers are taken care of, and that's how we'll build a sustainable future for agriculture. So thank you, Sherry, for having me here, and appreciate the opportunity to be a part of the Alliance, and excited to promote these resources all across America.
Great. Thank you so much, Jessica. And thank you for sharing that research too. I think that's really important statistics that really underpin and affirm this resources. And thank you for all that you do broadly in this space, and for you personally and your support as well. So thank you, Jessica. And Terry, I'd like to invite you to share why you joined the Alliance and the value that you see, and anything else you would like to amplify today.
Yeah, Sherry, thank you so much for having me on and talk for a few minutes about farm rescue. So we're very pleased to be a marketing partner in this alliance for a couple of reasons. Number one, probably a lot of the folks that call in or reach out could maybe use our services. So what we do is help farm and ranch families in crisis. That can be a health issue, whether it's an injury or mental health or an illness, or a drought, flood, tornado, anything that keeps a family from putting their crop in or taking it out or taking care of their livestock. We come in with volunteers and equipment and do that for them at no cost to the family. We currently serve 8 states, going on 9. So we're in Iowa, Illinois, Nebraska, Kansas, North Dakota, Minnesota, South Dakota, Montana, and very soon Wisconsin, starting July 1st. So we can offer planting, harvest, haying, commodity hauling, hay hauling. We're hauling hay right now into Nebraska and other places that suffered from wildfires earlier. And so we have over 600 volunteers from around the country, and they're ready and willing and able to help when a family needs us. So we can be a resource for the folks that call in or reach out to Togetherall or PAS. On the flip side, obviously, when we are helping a family, there is a lot of stress, a lot of concern, a lot of needed resources, whether they're suffering from an injury or an illness or a major natural disaster, and they're trying to clean up afterwards. And And so it was a farm rescue person that asked about resources for our pickups, because our volunteers are at and with each of these families while we're helping them. And so us being able to provide them easily with information to reach out through your organization and network to get help will be much appreciated. We are not licensed counselors. We're not financial experts. We're not mental health clinicians. So having these resources for our volunteers, our staff, our partners, both sponsors and media outreach partners, we want to help spread the word. And we hope folks will do the same about farm rescue in those 9 states, and we'll be growing. But for now, those 9 states we serve in.
Great. Thank you so much, Terry. And thank you for all that Farm Rescue does too. I think it is a great complementary service that you provide, wrapped with Togetherall and personal assistance services. In fact, some of the farm families I interacted with, I highlighted your services because they were having some challenges with planting this season. So
Right.
thank you for all that you do.
Anybody online
And
or just have them go to farmrescue.org, by the way, sorry.
And I just thought of something in response to the question about, can I have something in my pickup? And I just wanted to share that I am trying to lean into technology myself. And I now, when I go to meetings, I have the QR code for my own contact information on my screensaver on my phone. So I can just hold my phone out and I don't have to even go into it, and I can scan the QR code. So too, can you do that with the QR code for Togetherall? And so I encourage anybody here to share that. And if you need help, if you're not familiar with how to do that on your phone, reach out to others. We can help each other. So I think that's an easy, no cost way that we have that QR code on all of our phones in our pickups and wherever we are, so that wherever we are, we can share this wonderful resource. So with that, I'm just going to double check if there were any other questions. I think we probably have lots of great resources in this community on this call today. So encourage continued contact with each other. And just as a reminder that this recording will be available on our YouTube channel, and we'll encourage everyone to share it in their networks about this wonderful suite of services that are being provided. And as a reminder, there are many wonderful resources already out there in terms of, emergency hotlines, suicide hotlines, train the trainer resources. And what we believe is all of those are important services for the ag community. And we've been told, and we believe that this Farm Family Wellness Alliance is additive. It's not competing with those resources. We need all of these resources out there to help the ag community. So thank you for everyone who is here today. Thank you for all of our partners in the Farm Family Wellness Alliance. And we invite you all to stay in touch and continue to get the word out about this. So with that, I think we'll call it a wrap. And I think people are putting a few more resources in the chat. So check those out. And with that, I'll encourage us all to be well, and we'll stay in touch. And thank you for all that you do. Thanks so much, everyone.